As a classroom teacher, it is your job to look for learners that are a little bit different and need a little bit more support. And the more experience that you have in the classroom, the better that you are at noticing students that are just a little bit different. Now, students that come into your classroom with major physical disabilities or significant hearing or vision disabilities, probably most that have been diagnosed with autism, speech or language problems, or severe mental impairments, will already have some sort of 504 plan or IEP in place if you are a kindergarten or public school teacher in the elementary grades. For those of you that will be teaching preschool, probably most of those disabilities will have been diagnosed at this point, but sometimes there are a few that are not, especially with hearing or vision and autism and speech. But either way, it's your job to be advocating for your students and also really notice when something is off. A lot of disabilities don't develop later, but they don't show themselves until a little bit later. And when you get into that regular school setting, you can quickly notice when something just doesn't seem quite right. Some of the disorders that are quickly caught in kindergarten or first grade are processing disorders with vision or hearing, ADHD or ADD, emotional, social, or behavioral disorders, fine motor disabilities, students identified as gifted and talented, or specific learning disabilities. These are the things that are a little bit trickier to diagnose because they're not quite as severe. Or developmentally, children are different at younger ages, and we can't tell what's just a difference or something that's developing more slowly and what is actually a disability. So as a kindergarten or first grade teacher, you have a really big job on your hands to diagnose, or actually you're not diagnosing, but to notice a student that may need some assessments or diagnostic tests to see what's going on there. Sometimes, again, it's maturity, it's something developmental, but many times it's something that we really need to look further into as a team. On the right, you can see the list of common attributes of children that may have a problem. Students that are distracted often, and this is significant, or distract others. Students that are impulsive or would physically hurt someone. And also a big one is where we see a difference between what is their perceived intelligence and their classroom ability. This is often difficult for teachers because they don't know what the child's intelligence is, and all they see is the classroom ability. And oftentimes it takes working with specialists or especially with parents or teachers in prior grade levels to see what might be that discrepancy. Any child that falls behind significantly from either the other learners in the class or just what is below basic in your grade level is someone you want to have a red flag on for a while and just watch. Students that get frustrated or anxious very easily or have anxiety over testing or assessments or performance or anything. And also, any child that would have an exceptional ability, someone that you would see is way above the class, someone who learns very quickly, someone who gets very involved at a higher level, thinks more deeply. Those are your students that may have a gifted or a talented ability. But you want to watch for these signs in your classroom. Also on page 77 in your textbook through, page 82 and 83. They actually also give you specific guidelines to watch for in your classroom for the different areas of disabilities, to be sure that you've read those pages because those are the things that really will make a difference to the students. As you'll see as we go along in this presentation, the earlier we can diagnose a student, the better chance they have of overcoming whatever problem is holding them back. So it's really important that you're advocating for each learner and you're noticing when things are a little bit different.